Good day, fellow learners. Once again, this is your mentor, your fact check buddy Gapuz, joining you for another teaching and learning session here at NCLEX Gapuz Mentors. Well, here we go without further ado. Okay, so this is your next generation nclex-rn Pointers-8. Now, what are the things that I'd like you to remember for those who are taking the test, maybe tomorrow after watching this video, or in the next few days? Join our hundreds and thousands of passers from around the world. Give us a text or a call, 0906-201-9383, or send us a message through email, info@regapusreview.com. So here's one of those passers, and let's learn from her experience. Good day, fellow learners. For this nclex-rn Next Generation, pointers number 8, I'd like to first and foremost congratulate Ms. Diane Ortiz, USRN, for passing the New York Board of Nursing Next Generation nclex-rn test last May 18, 2023. And you bet, she actually shut down the NCLEX at a minimum number of items of 85, and she passed it. That's the most important part of it. Now, what I remember with Diane is she's the kind of student who would always ask me a lot of questions, whether this has something to do with the review classes or not. And in fact, I searched on my email, and this is what I saw. So she sent me this message, please help my brain cells. It really caught my attention, and that's last January 10 at 8:54 a.m. And she says, good day, Sir Ray. Thanks for being generous to your students. I would like to ask for help po. My exam is on May 18. Bagong set na po. Hu. My brain cells are deteriorating because of aging. Hahaha, I am a mother of 3 also. Ano po ba ang mga tips after po dito sa class? Should I attend again the review until my exam date po? Feeling ko po kasi hindi na nare-retain sa akin after ng lecture yung na-discuss. Thank you very much po for answering my email and for helping po. May God bless you with good health and longer life. Best regards, Diana. Salamat, Diana po. What I told her is this, okay? Say, your logical abilities are high. I suggest you attend the quick fix session that starts on March 18 onwards. See you. And she says, thank you, Sir Ray. See you on March 18 onwards. And she says, you are the Florence Nightingale of my life. Thank you very much and for saying that. And I appreciate it. But the most important lesson that we need to get from the experience of Diane is actually this. She knows how to be grateful. You see, she lost a lot of weight preparing for the NCLEX. That's a joke. This was just taken a few hours back, okay? And let's listen to what she's going to tell us. This video was actually filmed immediately after the quick fix, so she has yet to take her test, but she was asked by my staff which aspects of the review program she loved the most. And this is what she has to say. Let's begin.
Hi, I'm Diane Ortiz, student of RA Gapuz Review System.
Hi ma'am, how is it different from your comprehensive review and bootcamp experience?
My bootcamp experience, sobrang saya, sobrang cool, sobrang informative. Wala akong masabi, all worth it. Yung pagod, yung travel, yung sacrifice mo na hindi mo kasama yung family mo for 10 days, yung lumipat ka ng ibang lugar, all worth it siya. Kasi para siyang comprehensive review na nakapack in 10 days. Very maganda yung place. Napaka-convenient ng lugar and napaka-conducive niya to learners like me. Compared sa Compre is talagang full pack eh. Parang yun yung nag-aral ka ng 4-year course ng nursing eh. With my experience dito sa RA Gapuz. Yun yung napansin ko. Compre, 4-year nursing course mo, and then yung bootcamp, yun yung parang nag-review ka ng Compre.
Thank you ma'am. How do you find our quick fix session?
Quick fix sessions are very relevant to the trending topics. Very brief, simple, na mare-retain sa mind mo. and nakaka-help pagka nag-exam ka na.
What aspect of the quick fix session do you find most helpful or you enjoyed most?
All the tips, all the trending topics na dinidiscuss, yung mga materials, like yung mga may pictures, yung portion na pina-experience sa amin, yung SATA questions, all the exercises, test drills, the discussions, lahat siya na-appreciate ko. And I think nakatulong sa akin.
Thank you, ma'am. Here's the last question po. Will you consider referring our quick fix session to the future test takers?
Yes, as in, dapat mag-quick fix before mag-exam. And hindi lang yun, pati compre and bootcamp.
Okay, ma'am.
Okay, so there are three things that she highlighted: comprehensive review, the bootcamp, and of course the quick fix. But she actually failed to mention she loved the core shell as well. And we're gonna have more on that in our next video. The next important thing that you need to remember would be you have to know which topics to focus on. And here are my pointers in this video. So first, septic shock. When you say septic shock, this could be a complication of infection. So therefore, if you think about the risk factors, any condition in which the client is predisposed to develop infection could be a risk factor. So remember the code DRUM-BEAT, D-R-U-M. Okay, D, diabetes mellitus, that increases the risk for infection. R, resistance, that is low, or the presence of respiratory infection, that's the most common cause of septic shock, respiratory infection. Use of corticosteroids, so the patient is immunocompromised, leading to low resistance to infection. So the same is true for patients undergoing chemotherapy and radiation therapy. Then malignancy or cancer. And then you have DRUM, then BEAT, B-E-A-T, burn. So a burn patient, remember the skin is the first line of defense against infection. So if the patient gets the skin burn, so they are at risk for infection. Next, environmental factors, meaning if the patient is in the hospital for a long period of time and the patient has catheter, they are at risk for ascending infection. Then age, that could be extreme. So the very young and the very old, the elderly above 60. And then T, trauma. Okay. And then the manifestations, since this is a shock state. Remember, the blood pressure is low. And then the temperature could be high, and sometimes it could be fluctuate. It could fluctuate to low temperatures. And the level of consciousness will definitely be decreased. Now, take note that the patient in septic shock could also be having fast but shallow breathing. Now, what would be the treatment? AFV. So A would be antibiotics. Remember, you have an infection. F would be fluids, and V would be vasopressor drugs. Remember, the blood pressure of the patient could be low. So norepinephrine could be given, okay, vasopressin, and of course, dobutamine. That is to expand the fluid volume of the patient. Okay, next, let's move on. Bacterial meningitis or meningococcal meningitis. Remember, let's differentiate it from viral meningitis in terms of isolation precaution. Viral meningitis requires standard precautions. Bacterial meningitis requires, take note, droplet precautions. And when you say droplet precautions, healthcare workers entering the room should wear the face mask because your bacterial meningitis could be transmitted by sneezing or coughing. Now, what differentiates bacterial meningitis from viral meningitis would be the presence of petechial spots that could be bluish or brownish. Now, what symptoms would tell you, or in other words, what syndrome would tell you that the patient's having bacterial meningitis? First, you have fever, and then stiff neck. But take note, stiff neck may not be present in infants. It's difficult to assess stiff neck in infants. Rash that are petechial, bluish or brownish, usually in the trunk. And then photophobia and phonophobia. Because of the photophobia, provide them a darkened room. Because of the phonophobia, provide them a quiet room. Okay? And then pay particular attention to the 4 vaccines that could help prevent bacterial meningitis. And these are your meningococcal vaccines, your pneumococcal vaccines, your Haemophilus influenza, and of course your BCG. But of course, take note that BCG is for the prevention of Mycobacterium tuberculosis, and it's not widely used in the US. Okay? So those are the things that I'd like you to remember for bacterial meningitis. And of course, the concept of malpractice. Now, let me differentiate this from negligence. Now, remember, when you say malpractice, just in negligence, there is an injury, and the injury has resulted from an act of commission or omission. The question is, by whom? So, if the act of commission or omission that has led to injury on the part of the patient was done or committed by a non-licensed personnel, then the case is negligence. If it is committed by a licensed personnel, then the case is malpractice. So for the RN, the case will be malpractice. That's why malpractice is shortly defined as professional negligence. So therefore, malpractice and your negligence have the same elements: duty, presence of a duty, breach of that duty, causation, and injury. So there is a relationship between the breach of duty and the injury, and that's what is called causation. Now take note, the most important element there is injury. You cannot sue for malpractice or negligence if there's no injury. So therefore, what if you are asked on the test, what are examples of malpractice? This is a tip that I'd like to highlight. Look for situations that could potentially lead to injury to the patient. Like, for example, failure to identify the development of complications or worsening of the patient's condition. Definitely, that's malpractice. Failure to failure to follow instructions of the manufacturer related to the use of an equipment that could potentially lead to injury of the patient. So that is also a form of malpractice. Failure to raise the bedside rails and the patient fell off bed, so that could be indicative of malpractice. Failure to check on the absolute neutrophil count or the white blood cell of a patient who is on clozapine, which is an atypical antipsychotic, and so happened that you didn't check that the absolute neutrophil count and the white blood cells are already low, you still give the next dose, that's malpractice. Failure to check on the digoxin level before giving the drug, patient is already having manifestations of digoxin toxicity like nausea and vomiting that are persistent, or persistent lack of appetite, and you still gave the next dose, that's a failure on your part to identify the worsening of the patient's condition. So that could potentially indicate malpractice. Look for the situations that could potentially cause harm or injury for the patient. And definitely, that's going to be an example of your malpractice. Okay? So when you're studying for the NCLEX, since this is already next generation NCLEX, it can't be that you just are relying on your paper-based materials. Now here at the Ray Gapuz Review Center, we combine paper-based materials with our latest technology product, which is our Ray Gapuz Core Shell. So we cover all the subject areas on the NCLEX, like safety and infection control, basic care and comfort, health promotion and maintenance, physiological adaptation, reduction of risk potential, and psychosocial integrity. Now, what are the components of the core shell? You can choose to have short quizzes, long quizzes, standard multiple choice questions, SATA questions, or the next gen items itself. We have a lot of next gen items, especially case studies, and you can access this anytime, anywhere. So it's actually very affordable. It's just $149 for unlimited access. And the next thing that you should do is to give us a ring now, right here, right now, if you want to pass the NCLEX, okay? And of course, the most important and the third element of passing the NCLEX, you have to be in a conducive environment. So that's a Ray Gapuz NCLEX simulation room at the Ray Gapuz building, second floor here in UN Avenue. And this is how intimate our face-to-face classes are. So see you in our next class. Book now because slots are usually being filled that fast. So may I invite you to take the next generation NCLEX Flex, the most flexible test prep class for the nclex-rn. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, your QBank plus 3 books, and of course, the next generation NCLEX strategies by me, Okay, your mentor, fact check buddy Ray Gapuz, plus 24 hours conducted in 3 days of quick fix sessions. The fee starts at 3,499. You can choose between an AM or a PM schedule or just weekend classes. Once again, give us a call at 0906-201-9383 or send us a message at info@ragapusreview.com. Once again, this is your mentor, your fact check buddy Ray Gapuz, saying a functional concept a day keeps your nclex-rn fears away. See you in our next video.